I was at. When I started in this job, young people were different to the young people of today. So there wasn't TikTok, wasn't really Snapchat.
No.
Facebook was still there.
Welcome back to our podcast. So I'm interviewing our amazing social worker, Simon Darby.
Yeah.
Do you want to introduce yourself, Simon? I've just introduced you already.
Yeah, I'm Simon Darby. I'm a Young Lives versus Cancer team leader, social worker in Northern Ireland. I have been with Young Lives versus Cancer, formerly Click Sergeant, for 13 years.
Wow.
Yeah, unmanaged.
Do you feel old yet?
No. I don't.
Oh, that's good.
Yeah.
So tell me a bit about your role.
So currently, as it is at the moment, I manage a team of 2 social workers and a social care practitioner, and I run the service for Young Lives versus Cancer, the social work service in Northern Ireland. Before that, I was a senior prac social worker, and before that, I was a young person social worker. So it's varied over the years. I still support young people who are diagnosed and families who are diagnosed. My role is, I suppose the best way to put it is that when somebody faces cancer, and they will likely see one of the clinical nurse specialists straight away, is to kind of come in to complement that nurse to look at the non-clinical aspects of how cancer impacts on young people's lives. And then to kind of help resolve, first of all, to assess what that need is and that impact, predict some of the impact based upon what we already know as an organization, and put in services or help in ways to reduce that impact, whether that's financial, emotional, or practical.
Yeah. You do a lot, so a small snippet of all the work that you.
I mean, cancer ripples across, more than anyone. It ripples across people's lives in ways that another person with the same diagnosis, it won't affect them in there, just because either they're not doing like GCSEs and they could be 24. But a 24-year-old might be worried about mortgage and travel insurance, and a 16-year-old isn't. So you're actually
working with people of a range of ages. When you think about it, you think about social work and people's in children's services and adult services, but Young Lives kind of covers,
we're 0 to 24.
So it's a big age range.
And
do you feel, Simon, you're not now in more of a managerial role, or do you still get to work with people?
I kind of have the best of both worlds. So I get to support my staff or manage a team and lead the service, and then I get to still support people when they're diagnosed, as well as still do group work, which I absolutely love. And I'm kind of so lucky that twice a week I get to coach our Move Forward program, because it's important for me that kind of still exists.
So you still have that contact with the young people too. And it's things that you've created as well, Simon. You created that Move Forward project, and you still want to be involved in it, as you should be, as just still enjoying it, and kind of, because I suppose when you do move to a managerial role, you still kind of miss that work with the young person and kind of being one-on-one with
and it was I suppose it was one of the decisions when I took on the role, was I was kind of saying, no, I want to, I still need to. I think it's important sometimes for organizations to try to have managers stay on the ground with frontline work, because it keeps you in tune with what's currently happening within cancer services or within young people's lives.
And different trends and stuff that are coming up, and just keep in touch with, as I say, down with the kids. You have to make sure you're not missing out on like TikTok and things like that.
I mean, today I already had a conversation about the use of YouTube versus TikTok versus Instagram for video podcasts. So
you're still learning, Simon, every day.
Every day is a school day.
I know. And what about you? When you were going through your social work practice, Simon, do you think things are different now? Did you envision yourself in this kind of role?
I mean, I think it was about 15 years ago when I started the degree, and I remember going for the interview. So I actually wanted to be a social worker when I was 16. There were 2 people in my school who knew what they wanted to do, and that was my twin, who wanted to be a nurse. And me who wanted to be a social worker. Everybody else was like, the smart ones did law or medicine, and other people were doing other stuff. And so I applied to go and do it in McGee, and I didn't get the A-level grades. I missed out on 11 points. But I remember going for the interview, and then I remember sitting in the big lecture hall, and there was me and there was one other guy, and I think he was maybe in his 40s. And the lecturer said, and ladies, if you just turn around and look at the back, those 2 men will be your manager one day.
No.
And I remember just everybody turned around, and I was like, I don't want to do this. I was so intimidated by it. And then I went and did a psychology degree first, which was a nice foundation to have, and you'll know it yourself. Like when it comes to even just understanding how to write an academic essay.
It's like your trial run degree. That's what I call it. Because I was like,
a very expensive trial run degree. But
still paying it off.
Yes. And then I kind of like did jobs, and then I decided, no, I'm going to go back and do the RGR route with Queen's. And did the 2-year degree, loved the placements, loved the fact that one was statutory and one was voluntary sector. Well, actually, both were meant to be like that. But both of mine were actually voluntary sector.
Oh, really?
One was in family and childcare, and one was in offending probation. So I loved that. And then, but I remember my interview, and the girl who interviewed me and answered all the questions, and I had like my phone so I could measure the time of the interview, and like 15 minutes had gone by the interview, and she said, "Do you have any questions?" I looked down and went, "It's only been 15. This is internal monologue. It's only been 15 minutes. I have messed this up. I'm not going to get into this degree." So I just turned around and went, "No, I don't have any questions, but I want you to really know I want it." I started crying. I was saying I really wanted to get onto this degree.
No way.
Mortified. And then didn't actually get into Queen's, got into Ulster University, and then about 2 weeks before we were due to start, Queen's then said, "No, we'll offer you a place." So it was great, because that was closer to home. But then when I had that lecturer who interviewed me in my second semester of second year, she pointed me out, and she said, "I remember you crying in my interview. I'm glad that you're here." I was mortified for the second time.
But it just showed the actual passion, and that you really, really wanted it.
Yeah. Well, if that didn't come across with a grown man crying, I don't know what else would.
And the Oscar goes to. And did you enjoy doing your degree in social work?
Yeah, I did. I definitely think it worked for me. I'm a visual learner, and I love role plays, and I like to learn through kind of interaction. So I really love that aspect of the prep for practice modules, and then going into social work. I've also kind of consciously chosen as a social worker to work within the voluntary sector more, because of the working in the grey areas of kind of practice and stuff like that.
Yeah. And do you enjoy your role?
Oh, I love it.
Yeah.
It's one of those ones where people will be like, "Oh, Blue Mondays," or on Sunday they're so depressed about it. Whereas I'm like, "What's the week going to bring?"
Yeah. And you're all go doing different things.
Yeah, I love that in this role I could be in Fermanagh tomorrow, and I could be in Strabane on Thursday, and I could be in Altnagelvin Hospital on the Friday, and I get to see the best of Northern Ireland scenery. You're
out the window of the car, like
absolutely, yeah. And there's parts of the driving around the loch sometimes is just. In fact, I remember I was supporting a young family where the girl had passed away, and they were out the Portaferry Road, and just driving along that road when the sun's setting was breathtaking. It just genuinely took my breath away.
Yeah. And just as you were speaking there, Simon, this is something I think we've talked about before. I had a really amazing experience, with yourself, and really, really positive. But in your role as well, Simon, there's a really difficult part of it, and really negative side of things. And how do you manage that with resilience and things like that?
Yeah, it's a good question, and I think sometimes I often get people's reactions default to that. When I tell them what it is, they go, "I don't know how you do your job," and I'm like, but there's a lot more positives than there are negatives. So for me, it can sometimes be when somebody texts us to say they've just found out they're pregnant, and they're like just finished, or not just finished a treatment, a good few years treatment, or they've done their driving test, or they got the A-level results, or little things like that. I always focus on those moments. There are occasions, thankfully not as often as what people think, but where young people pass away as a result of their cancer experience. And then there's families that are left bereft in the wake of that. But I often think that those are the moments where it's still a privilege for me to be able to support them to work through that grief, to get to the stage where they can kind of access services and move on in a more formal way. And I think about them all the time, but not in a negative way. They make me smile sometimes. I remember there was a young guy who was doing maths at Queen's, but he liked to invent stuff, and he was inventing an attachment for the back of your car to put your wheelie bin on.
Wow.
And drive it up a country lane, because he hated having to drag it down. And every time it's bin day, he pops into my head.
No way. And you just think of these ways.
Yeah.
That's class.
Yeah.
That is so good. And it is good, Simon, as well. Like, do you know, obviously I've met people that have passed on through cancer and things like that, unfortunately. But I always think of the good memories as well, too. It's always just thinking about, do you know, the good times that you've had and the real positive experiences.
Yeah.
And what about self-care then, Simon? What's that look like for you?
My default is normally to talk about wine, but I don't. For me, I go to the gym as much as I can, so at least kind of like 3 times a week, and that's a space. And I've always consciously done that from the very beginning, used that, and now I feel it's just a default to kind of process some of the heavy stuff, or even just to feel like, well, I'll leave it here, and then when I go home, I'm at home. And I remember when I started in the hospital, there was revolving doors. They're not there now, but there was revolving doors, and I always had this mantra that when I left, I said, I'm leaving this here, I'll pick it back up tomorrow. And I did that for so long that I subconsciously then just left things at that door. COVID was the first time that I realized that I'd done that, because we didn't have that ability anymore. And then sometimes I would find getting into my car after doing a bereavement visit, I needed to like take time to process before driving.
And that's really vital as well. And even for, you know, people thinking about going into social work and things, it's all about those things too. What would you advise someone, Simon, thinking about going for social work?
I think if you're even thinking about it, then that's enough to then say, I should give this more thought and find out more from, and I would say go and ask loads of different types of social workers what their advice would be, because my experience has been amazing, because I've chose to work in the voluntary sector and find it the most amazing place to do practice. But somebody who's working in the statutory sector or in the private sector might have a different, and that is the reality. Not all jobs exist in the voluntary sector. So go and speak to as many people as you can. Speak to people who have recently or on the degree, who can then talk to you about like what the demands are. Because I think if you come in from A levels straight into right in academically, it's such a shift.
So difficult.
I even find it a shift to go, having done a degree, had a couple of years out.
And then go back again. You were like, how do I write my name?
No, I will definitely say I think it's different being a student now. I think the support services are a lot more there. So even if you're somebody who's been through cancer and thinking about doing it, this like get your social worker to speak to the universities about the supports that are available. I mean, AI, I think, is going to absolutely change the way we do things, even within social work going forward. But as a student, I would be all over ChatGPT and all of that sort of stuff. Not that I think it's to replace, but more to enhance and to get me to think about how to structure essays by just asking artificial intelligence to suggest how I do that. So
there is a lot more supports as well. And I even find as well, going through your service as well, Simon, too, you know, I was getting a lot of supports through university as well, which was really, really helpful. And then what one word, Simon, would you use to describe social work?
Evolving.
That's a really good one.
Yeah, I think for me, I talked about it recently at a conference or a talk I was at. When I started in this job, young people were different to the young people of today. So there wasn't TikTok. There wasn't really Snapchat.
No.
Facebook was still there. But social media was not. So like when people always say, and I hear doctors and nurses say all the time, being like, when you go home, don't Google. But the reality is that you don't Google, you TikTok, you search for it and you find. But it's just a different world now on social media. There are so many people just saying like, you know, use this and do this and don't take that. And I often think that we have to move, our service needs to move, and as practitioners we have to move with the change of cohort or groups or generations. And I think the younger ones about to come into cancer care or come into this world of cancer are ones who are used to asking technology to turn the lights on and turn the lights off.
I know. Or do your homework.
Yeah, exactly. Whereas, and the hospitals are not at that level.
Yeah, no, I know.
So it's a different generation, you know. I think it was in a palliative care talk that I was speaking about, you know, when a young person's passing away, death to the younger generations doesn't necessarily resonate the same way, because they've grown up with Animal Crossing and Wheeze and digital avatars. So for them, existence and death is outside. It's a digital thing. So when we think about people dying, they're kind of going, well, my profile will still stay live and I'll still live on like that.
Yeah.
I didn't see that 10 years ago.
No.
Evolve is my word.
That's such a good one. That's so like out there. I love it because it's so true though. Yeah. And it's just going to have to be, you're going to have to be in TikTok more and learning all the dances and being an influencer.
Simon 10 to get 10% off.
No, you can't be leaving social work. You have to stay where you are.
Silent.
But yeah, no, I just think you're an amazing social worker, Simon. You've had a massive, massive impact on not only myself, but all the other people that I've met through the cancer journey. And just a million thank yous. It isn't even enough. And
it's my pleasure.
You totally deserve where you are at the minute. And I'm sure you'll go very, very far. Thank you.